What happens when you map pollution, social stressors, and health burdens all at once? You see which communities are carrying the heaviest load. Listen into this episode to hear how cumulative impact science works, why it needs community leadership to be effective, and what defending science integrity looks like right now. You're listening to the PHEC podcast, episode 448. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, also workshops and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will also be provided in the show notes. I'm very excited to introduce you to my guest on this episode. She studies cumulative impacts, how pollution, social stressors, and health challenges pile up in the same communities. As a scientist, she spent years mapping environmental burdens in Minnesota, co-developing community guides with environmental justice leaders, and pushing for science that integrates measurements with lived experience. Right now, she's also tracking something alarming: unprecedented attacks on federal environmental health programs. This conversation covers how cumulative impact tools work, why community leadership makes science stronger, and the dismantling of federal advisory councils, as well as concrete ways to defend evidence-based environmental protection. Let me formally introduce her, and then I'll connect our conversation. Dr. Kristie Ellickson is a senior scientist at the Union of Concerned Scientists. Her research focuses on cumulative risks and impacts, fair assessment in government decision-making, and environmental justice. She also works on a database that catalogs and categorizes attacks on science. Previously, she was a state scientist for the state of Minnesota, where she worked in air toxics, computer modeling, and measurements, co-developing a cumulative air pollution risk model and integrating those results with socioeconomic data to investigate disproportionate impacts. She also led community air toxics monitoring grant-funded work. Dr. Ellickson is an environmental health scientist and earned a PhD in environmental science and public health from Rutgers University. Let's connect my conversation with Dr. Ellickson right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC podcast community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Hi, Kristie. Welcome to the podcast. How are you?
I'm good. Thank you for having me.
I'm very excited for our conversation. You and I met at a conference a few months back, and I remember standing there at your booth, and you had a colleague there. You were explaining your work. And in my head, I was going, "Ooh, I'd love to have them on the podcast." So I'm happy that you're here. Why don't we start from the top? I'll have you just introduce yourself and just tell everyone a little bit about what you do.
Sure. Yeah, I was happy to meet you at the American Public Health Association meeting where we were tabling. My name is Kristie Ellickson. I work for the Union of Concerned Scientists, and I'm a scientist there. And we are an organization that produces science analysis as well as advocates for science based policies for a healthy and safe planet. So I can talk a little bit more specifically if you want to.
Well, I definitely will have you dive into that. But what I often like to do is roll back time a little bit and figure out how you got here. So, one of my favorite questions is to ask, when did you first learn about public health? Do you remember a time or when that first became clear to you?
Certainly. And I don't know if I knew the phrase public health at the time, but I was a chemistry major in college and I was very interested in how chemicals interact and move. At the time, I was realizing I was interested in how chemicals move through the environment, transform. And after college, I was a U.S. Peace Corps volunteer in Panama, and we lived in a site really far. It was, about an hour walk uphill from the road, and a mining company came into our town. It was a very small place. It wasn't really a town. A mining company came in and they were doing exploration to see if mining activities would be profitable. And a lot of folks in our area were excited for income generation and nervous about what that would mean. And so at that point, I realized that I wanted to continue to study and think about and learn about how chemicals move through the environment. And I knew people had to be a part of that. And so I have ever since studied and worked on environmental health.
That's a fascinating story. I know a lot of our listeners have volunteered with the Peace Corps, and the environmental health angle and aspect, bringing that to the podcast is really interesting one. And I'm excited to dive in a little bit more. Thank you for sharing that. I'd love to hear the journey about how people discover the public health with or without understanding that it's truly public health, because that's was also partly my journey. I didn't know public health until I was really in it. I'd already been in healthcare for 10 years.
Mm.
So it's interesting. So fast forward, I guess, a bit. How did you kind of move into the work that you're doing now?
Sure. So I worked as a scientist for the state of Minnesota for a long time after graduate school. And I came to that position studying exposure science. So, how people are exposed to chemicals and pollution in their environments, land, air, water, food, etc. And so we had a program in the state of Minnesota at the time to look at all of the emissions of air pollutants for the whole state from all different sources and kind of look at that on a map. And so we could also overlay who lives there. And like lots of states in the country, we could see and show that communities of color and low income and low wealth communities had had higher exposures and lived in closer proximity to these sources of pollution and had higher exposures. And so that's what we worked on, those types of analyses to try and push what is called environmental justice in the state of Minnesota, and also trying to evolve how environmental chemicals are regulated from looking kind of one chemical at a time, from one source at a time, from maybe only air, even though that's a big task, but to look at things more holistically, to look at environmental protection in the way people are actually exposed. And that's called cumulative impacts. So cumulative impacts is a tool, a concept of doing environmental protection that is more linked and more reflective of how people are actually exposed, which means that people have differing levels of health burden. They have different exposures to social stressors, like having to deal with material hardship or exposures to racism, et cetera, and differing levels of not just one type of pollution. And so I worked in that field for a long time in the state of Minnesota, and a law passed while I was there. A lot of really, really good work was done and continues to be done, but I needed to change a bit. And so I moved into a position in the nonprofit world to continue to advocate and study these policies kind of more on a national level. And so that's where I am now. I sit in the Center for Science and Democracy at the Union of Concerned Scientists, and we look at all aspects of democracy. We have a group that looks at election science, and then another group that I'm a part of, we look at fair access in government decision making and cumulative impacts. One of the biggest findings, and I can talk about where that comes from, is the importance of including impacted communities, people who may be negatively impacted from the very beginning. That's like fundamental in public health as well, learning from people who have lived experience and lived expertise. So I work on cumulative impacts also within the Center for Science and Democracy.
Tell me a little bit more about that in terms of the work with people. How involved are you with the community at this level of gathering data and learning about this cumulative impact? Tell me a bit more about that.
Sure, I can talk about it in a lot of different ways. So, one of the ways I can talk about is when I was still at the state of Minnesota, working for the state of Minnesota, we got a grant to study air pollution in different communities. And so we had meetings and so forth with people in communities to say, where should we put up these monitors? Where are you seeing, experiencing, smelling, hearing what could be more sources of pollution and so forth? So that's kind of community informed. But important in a lot of that is also having that same community be a part of the ultimate decision making. What do you do with that information? And so I came on to Union of Concerned Scientists as a fellow. And so one of the things I did with partners, external partners, was write a scientific paper on how what is called mixed methods could be used in cumulative impacts. So mixed methods means when people think about scientists, they think of people taking measurements, people using a computer to model something, maybe doing a survey where you count the types of things people say. But again, important in all of this work, in environmental justice work, environmental health work, cumulative impacts work, and including all of public health really, is this qualitative information, people's stories, maybe how people experience something. And so mixed methods is when you integrate those two. And that's super important and very powerful. There are two ways of really getting at what is the situation here. We can measure things. We can use computers to model things, and then it can look like ground truthing with people in the area where you're measuring or modeling. It can also look like community directed work where communities are telling you, you need to model this, you need to measure this, and this is where you need to model and measure and so forth. So that is the idea. So we looked at in that paper, I have one more example after this, but in that paper, we looked at the studies in environmental health, scientific literature that had used mixed methods, and like, how do they do that? How do they integrate those two very different ways of looking at situations and who's doing it? So sometimes that might look like a different type of chart where you have people's quotes in your chart and so forth. Another thing I did together with a lot of people is develop a community guide to cumulative impact. So co-led that with a large environmental health network called Coming Clean. And we had co-developers who were community organizers, environmental justice type leaders, et cetera. And together we co-developed this guide. So what I say a lot in talking about that work is I could have gone into my basement and written something, but it would not have been useful. And so doing that work collectively and ensuring that people's expertise is paid for even, and co-developing this work, this community guide to cumulative impacts, I think was much more impactful and useful. And so that's the kind of work, that's the goal. Never perfect, but that's the goal.
I love so much of what you just said. The community-driven piece of that is so important. I think as researchers and scientists, sometimes historically that has been where we've fallen short in terms of really engaging community from the initial part of things, sharing back the information, also having them as a part of the decision-making process, like all those levels. I think historically that's where we've missed. And I really get excited to see hear examples where that is the priority as it should be. So I really love that. And I also am become a real fan of mixed methods. As a quantitative epidemiologist by trade, we're quantitative, and then also valuing qualitative research. But when we can bring those together, that is truly an opportunity to almost create a superpower, but it is very,
Mm-hmm. It
you
is
know,
a
and
superpower. I love that. I love that.
yeah. So
Yeah.
I really, really like hearing that from you and your examples.
And if it's okay, can I bring up three other?
Sure.
And I'm not the only one, obviously, who's saying this, and you're not the only one. So there's been three big resources developed in the last couple of years on cumulative impacts. The EPA, Environmental Protection Agency, developed a cumulative impacts framework, which is how the EPA at that time was thinking about cumulative impacts, how they were thinking about possibly operationalizing and implementing this. And a major part of that was this idea of community informed, community driven, that type of work. Also, National Academies of Science, Engineering, and Medicine just put out late last year the state of the science on cumulative impacts. Again, the theme is community driven, community validated, community informed type of analysis. Third, also National Academy of Science, Engineering, and Medicine. One of the cumulative impacts tools are these maps that you see. Lots of states have these maps that overlay maybe environmental pollution, social stressors, and sometimes health burden, like where are there more asthma, emergency room visits, et cetera. So they have these tools that overlay, and you can look at where's the most burden, and then you can use effective governance and work on that there and not think about one thing at a time, but really have more of a holistic look at things. And so a National Academy of Science, Engineering, Medicine, NASEM, also produced a big document on recommendations on building these tools, which you can call them mapping tools under cumulative impacts or environmental justice mapping tools. So lots of people are saying that there's a lot of work, a lot of resources to dig into and figure out how do we do this? How do we do it better? How do we continue to keep trying to make this common practice?
Yeah, absolutely. Exciting topics. I
Yeah.
know that, and I can't remember exactly which guest, but I have interviewed some guests for who are a variety of either health commissioners for their city or, small region, but somewhere in the conversation, I remember someone describing for their city, or maybe it was even a county level, but these overlapping tools that you just
Mhm.
described, which are very helpful in a great use of technology for the work, advancing the work and the mission that we do as public health, regardless of environmental or whatever industry or niche that we're in. These are really useful resources, I would say. I'm curious. I've got your website pulled up here and my mind's like going with questions. Can you tell me a bit more about some of your programs that you're involved in right now?
Sure. I'll talk about two things that we're working on right now. Some of our work has changed as a result of the current federal administration. So, as I might have talked about this earlier. Nonetheless, we curate a database on attacks on science. We tend to focus on attacks on federal science. And there are attacks on science in all administrations. This one is particularly problematic. We've seen unprecedented firings and dismantling of advisory groups and dismantling of programs in scientific based programs or federal agencies with a large science component to it. So we're following that and working on that and trying to analyze that to see, how do we address this? Another thing we've done that I have been somewhat involved in is because of this, now there is a big need for formal bodies, maybe outside of federal government, that do the work of advisory committees. I know in the vaccine space that's happening. And so we're trying to make that work in the, environmental health space as well. So that is something we've been working a lot on. We have a toolkit. Union of Concerned Scientists has a toolkit on how to convene a federal or a scientific advisory committee. And we do trainings on that type of thing because a lot of them have been dismantled in this administration. And that will be useful going forward forever, because that might be a useful thing for academics to look at, foundations, nonprofits, and so forth. Another thing we do that's telling the story of what some of these actions mean. Last year, the Trump administration developed a process for certain facilities to be exempted from environmental rules by writing an email. So there are 546 facilities that are exemption eligible. I think about over 200 of them, less than 250, have been exempted so far, either by that email process or by executive order. And so we did a story map. And again, this brings in that cumulative impacts idea of what does that mean? Because these facilities aren't islands, they're hosted by communities. So what other sources of pollution are around them? There are schools and daycares around these facilities. Sometimes there are language barriers in these communities, and that would impact someone's ability to be a part of that decision making. So part of that's lifting up, and part of that's telling the story of impact of these host communities and what's happening. So those are two things that I've been working a lot on recently, very recently.
Oh, it feels overwhelming because this is a reality that we are dealing with and living in right now. At the same time, it's reassuring to know that you all are doing this work. I do have a follow-up question.
Sure.
When you talked about the database of, these attacks on science and going through those to decide kind of what can be done, I'm just curious, what are some options? Like, what can be done as with this a massive amount of data that you're probably already collected because of just the nature of this last year. So at the time we're recording this, the very beginning of 2026, but thinking about all the chaos of 2025 and all of the attacks on science, like what are the possibilities? What are the options of what can be done with the data you've already collected?
Sure. So one of the things I learned when I came into a nonprofit space was how to work in a campaign and what that meant. And one of our campaign goals, our big campaign goals, is to ultimately pass the Scientific Integrity Act. And this has bipartisan support, the Scientific Integrity Act. It sits in the form of a bill right now. And what that would do would put guardrails around how science is done and keep kind of politics out of science. Let scientists do the science and let those results not be censored. Let federal scientists go to conferences to be able to talk about their results. And it would require that each federal agency develop a scientific integrity policy. And so a lot of that work has been going on through guidance. There were scientific integrity policies in several federal agencies in previous administrations, and solidifying that in a law would make it more consistent long term, and ensure that it keeps happening. So that's one thing that can be done, is to tell your decision makers, your Congress people, to support the Scientific Integrity Act. You can contact us and we will help you do that work. We'll help you. We have email language, which of course you would modify and edit and that type of thing. We do a lot of trainings and webinars on what scientific integrity is. And it sounds not like it will directly impact things, but it does. It's the foundation of everything. It allows all of these things to exist and not be politicized.
Yes, I agree. I think it's really important. I was also fascinated to hear about, the toolkit for like developing advisory boards. I think that's
Yeah.
also something, you're right. I've heard a lot about what's coalitions being formed for vaccine space and just a whole lot of different areas. But I didn't, the idea or the fact that there's this toolkit, that's a huge resource.
Yeah. We do trainings on that.
Yeah.
So please contact us to learn more about that.
Amazing resource. I am so excited to hear all of these things. I'm thankful that you've taken some time to come onto the podcast and share about these resources and to really talk about what you do and to really break it down a little bit further. I've definitely gone so far into all the questions that I had because I wanted to understand. I think I kind of gave you a warning up front. I may have a lot of follow-up questions because I felt like there's so much I wanted to understand. And in our conversation, my hope is that the audience is also gaining deeper understanding and valuing this work and the resources that are available as well. I will say this as we begin to wrap up. Is there anything that you would like to share that I haven't prompted or asked you about or maybe left out that you would like to add into the conversation?
Sure, I can talk about interacting with our organization if this is a good time.
Yeah.
So we have hundreds of thousands of supporters, and that can look like what you get from that is you would get emails about information from our organization. We have action alerts, this is happening and please call your decision maker, that type of thing. Lots of us write blog posts. So I have a blog post, I have a blog site where I work on trying to explain and tell stories about mostly cumulative impacts, sometimes toxics regulation, and more recently, what I have been doing is I'll lift up two resources. So the current administration dismantled the National Environmental Justice Advisory Council. And as that was happening, I got the opportunity to interview four of those folks because I had been interacting with that advisory council for a while. And that was great because you hear everyone's expertise and what they had hoped to do and what they're planning on doing now that they cannot be interacting with the federal government in that way. How do they keep pushing that work forward? I also got to interview and we supported Charles Lee, who did a lot of work in cumulative impacts for the EPA for a lot of years and was a leader in environmental justice within the EPA. And so I got to do that, to support him as a guest blogger on UCS. And then finally, this is a really good resource. Another person who unfortunately had to leave the EPA as a part of this administration. She used to be assistant general counsel. I'm not saying her exact role perfectly correctly, but Marian Engelman Lotto wrote a blog post for us on the legality of environmental justice efforts. Because there's a lot of talk that environmental justice work is now illegal, and that is not the case. And she's a lawyer at NYU right now, and she sets up the legality of environmental justice activities and initiatives. And that was an important resource that's on our website. So we've been trying to lift up not just what we say, but, other experts, lots of different types of experts in this field. So those are resources I want to talk about.
Thank you for sharing that. So I think that, again, looking at the website, I also see that there's a lot. If you're listening, you're thinking, this is really exciting. If you want, there's definitely the blog, which I'm going to subscribe to and kind of go through. There is the option to donate and provide support for this amazing work. Mm-hmm. Because if you, as an individual, or your organization is looking to make donations and support, the right places and the people doing this work, I highly encourage you to consider that option. And that's just a me push right there because I'm personally really energized and excited about this conversation and this discovery. And then also before we actually started recording, you mentioned an opportunity for folks, I think it was like student opportunities or people that wanted to get involved. Can you talk a little bit about that?
Certainly. Yeah. So we also have a science network. And so these are scientists, student scientists, acting scientists who join our science network, and we provide training for scientists to talk about the results and about their work to decision makers and to be able to kind of be that integration between science and policy. Because when I came to start working at the Union of Concerned Scientists, someone said to me, and I think we say that a lot in our organization, is science doesn't speak for itself. We need people to speak for science. And that takes training and thought, and we're happy to support people to do that. And we have, I think, around 20,000 science network members, and please join us. You're more than welcome. And we support Hill Days and that type of thing to directly talk to your decision makers about what your results are showing.
Yeah, that's amazing. Lots of great options. This is amazing. Kristie, thank you so much for taking time for sharing with us so much generously in this conversation for this podcast episode. I'm really grateful to have met you and to have you as a guest. Really appreciate you being here.
Thank you. It's an honor. Thank you so much.
I really hope you enjoyed that conversation as much as we did. Kristie's work makes one thing clear. Defending scientific integrity means centering the communities who live with the consequences. Cumulative impact mapping shows us who's bearing the burden. Mixed methods research honors what people know from lived experience. And right now, with federal environmental health programs under attack, community-driven science matters more than ever. As Kristie reminds us, science doesn't speak for itself. We need people to speak for science. Whether you're joining the Science Network, supporting the Scientific Integrity Act, or simply refusing to let evidence-based policy disappear quietly, there's a role for you. This fight needs all of us. I encourage you to connect with Kristie and learn more about the great work that she's doing at the Union of Concerned Scientists. You can find the links to connect on the show notes page. And the show notes page for this episode, which is episode 448, can be found at phecpodcast.com. Once you're there, just navigate to episode 448 to find the show notes. One more thing before we go. Remember that this podcast has an app and a private community, which is independent of social media platforms, where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes exactly like this one. You can download the PHEC Podcast Community app in your mobile app store. It's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.